Hello, uh, good evening everyone. I am Dr. Murali from India. Now I am going to explain how cochlea present in the lap of GSPN and labyrinthine part of the facial nerve, and how the labyrinthine part of the facial nerve present between two hard bones, cochlea and superior semicircular canal. Okay. Now this is GSPN. Okay, this is GSPN. This becomes horizontal part of the facial nerve. Okay, I am making it thicker. This is horizontal part of the facial nerve. Now, at the root of the GSPN, if I make a cochleostomy, that becomes superior turn cochleostomy. So if I make cochleostomy at the root of the GSPN, that enters to the superior turn. So in extensive cholesteatomas, if we want to avoid completely the middle ear, we can insert the electrode array through the superior turn cochleostomy by middle cranial fossa approach. So for that we can use this superior turn cochleostomy. Okay. Now this is horizontal part of the facial nerve. This is GSPN, and this becomes labyrinthine part of the facial nerve, and this becomes canalicular part of the facial nerve. Okay. Now when this enters into the superior turn cochleostomy, the next this becomes middle turn cochleostomy. Middle turn. This becomes the middle turn of the cochlea. The labyrinthine part of the facial nerve present in relation to middle turn of the cochlea. Suppose if I make a cochleostomy here, it enters into the middle turn, and now beyond that, this becomes the basal turn of the cochlea. If I make cochleostomy here, this will lead to basal turn cochleostomy. So the middle turn of the cochlea corresponds to the labyrinthine part of the facial nerve. So in the angle of labyrinthine part of the facial and horizontal part of the facial nerve, you will see the superior semicircular canal. This is superior semicircular canal. In the middle cranial fossa, you can appreciate this as arcuate eminence. So in between the GSPN and the arcuate eminence, you will appreciate the internal auditory canal. This becomes internal auditory canal. Internal auditory canal. So this is the canalicular part of the facial nerve. So in between the angle of the GSPN and the superior semicircular canal, you will appreciate the internal auditory canal. Dr. Maresona advocates exposure of the internal auditory canal from medial to lateral direction. So many doctors described various procedures, but Professor Maresona describes exposure of internal auditory canal from medial to lateral direction. So this is the GSPN, and this is the horizontal part of the facial nerve. At the root of the GSPN, if you make a cochleostomy, that leads to superior turn cochleostomy. In the angle of GSPN and the labyrinthine part of the facial nerve, you will appreciate the cochlea. So all the three turns of the cochlea, superior turn, middle turn and apical turn, present in the angle of GSPN and labyrinthine part of the facial nerve. And labyrinthine part of the facial nerve corresponds to the middle turn of the cochlea. If I make a cochleostomy just 1 mm medial to superior turn cochleostomy at the root of the GSPN, that becomes the middle turn cochleostomy. If I make cochleostomy 1 mm lateral to 1 mm medial to the middle turn cochleostomy, that becomes the basal turn cochleostomy. And this is the internal auditory canal facial nerve. So horizontal part of the facial nerve, labyrinthine part of the facial nerve, internal auditory part of the facial nerve. This is the GSPN. This is the superior semicircular canal. Okay, thank you.